Hello, greetings everyone, and shout out to all my loved ones, my friends that have been watching my video, following me, and then have subscribed to my YouTube channel. Shout out to you all. And please, after watching, liking my video, kindly subscribe to my YouTube channel. Those who have not yet subscribe, please kindly subscribe so that you'll be notified of new videos. Okay, and those who are here to watch my video, kindly uh, give me a shout out from wherever you are watching me. Okay, so I'll be talking about cervical cancer. So today I'm proceeding, okay, and I'm here to talk about what the stages of what cervical cancer and then the treatment of cervical cancer. So stage one of the cancer of the cervical cancer, the tumor affects the cervix, and you can only view this with the help of what, a microscope. So, stage two of the cervical cancer, the tumor has grown outside the cervix and the uterus, but not the lower part of the vagina. It has grown outside the cervix and the uterus, but what? Not the lower part of the vagina. Okay. So that is cervical cancer. And please give me hi from wherever you are watching me from, okay, so that I can give you a shout out in any video of mine that is here to come out, okay. So stage three of the cancer has grown in the lower part of the vagina, but not in the walls of the pelvis. That is stage three of the cancer. I hope you are taking note of the stages of cancer I'm talking about, or the stages of the cancer, and what I'm saying about the various stages, okay? And then the stage four of the cancer, the tumor has grown into the bladder and then the rectum, okay, or outside the pelvis. I said stage four of the cancer, the tumor has grown into the rectum and then the bladder or outside the pelvis. So those are the stages of what? Cervical cancer. I just spoke about some basic thing about this, the four stages I have mentioned. And I want to talk about the treatment of the cancer, the cervical cancer precisely. So treatment of cervical cancer precisely depends on some factors, or the treatment depends on several factors. And then I'll have those factors mentioned to you. And one, the stages of cancer is one factor. Another one is what? Other health conditions of what? The individuals. So these are factors that will help in the treatment of the cancer. But we have three main methods used in the treatment of what? Cervical cancer. We have the surgery that can be carried out, and then the radiation method, and then the chemotherapy method. Those are the three stages, three methods of the procedures that can be carried out in the treatment of cervical cancer. But also, don't forget that the treatment also depends on the stages of the cancer, as I mentioned previously. Okay, so in the early stage of the cancer, when the cancer is at the early stage, surgery is done to correct it. Surgery is carried out to correct the cancer. And then if the cancer has advanced, radiation it's combined with what? Chemo for the treatment of the cervical cancer. I said what? I'm taking it again. I just hope you are taking notice of what I'm saying. I am saying that I have just mentioned four stages of cancer, and I have just said something little about them which could be clear to all of you. And I said the stage one, cancer affect the cervix, and you can only view that with the help of a microscope. The stage two, the cancer has grown into what? It has grown outside the uterus and then the cervix, okay, but not the walls of what? The vagina. And then the stage three of the cancer. The cancer has grown in the lower part of the vagina, but not in the walls of the pelvis. And then the stage 4 of the cancer, the tumor affects or the tumor has grown into the bladder and then the rectum or outside the pelvis. Those are the stages I just spoke about. And I'm taking it again so that you get it to okay. So I'm talking about the treatment depends on some factors, and these factors are stages of the cancer, and then the health conditions of the individual will help in the treatment of what the cancer. So surgery, radiation, and chemotherapy is used as method of the treatment to correct the cancers. Okay, so the surgery is used when the cancer is at the early stage. Surgery is used to correct that, and then radiation and chemotherapy it's combined and used to correct when the cancer has advanced. I hope you are enjoying all the education I'm giving to you on cervical cancer. So, in my last video, I told you or I made mention that I'll be bringing to you treatment of cervical cancer, how cervical cancer is being managed. Okay, so those of you who hasn't heard or who has not watched about any video I have previously made about cervical cancer, you can please go back to watch the previous education on my cervical cancer, the cervical cancer I'm talking about, and then you come back to this video to listen or learn something about the stages and then the treatment. Until then, have a good day. But please, I said, well, don't forget to give me a shout out from wherever you are watching me. And after watching my video, you still have to subscribe to my YouTube channel so that you can be notified of any new video. Until then, see you in my next video.